So, shall we start now or we wait for the participants to come in? I need a cue on this. Hi, ladies and gentlemen. Welcome to National Conference on Behavioral Insights 2023. So for this stream 3, we have three speakers, esteemed three speakers, in which our topic will be changing behavior through nudge. So the three speakers we have here, which is Mr. Filippo Cavazzini, then we have Dr. Manimaran, and the last one is Mr. Anwar. So I would like to introduce first the first speaker, which is Mr. Filippo Cavazzini. He is senior economist from the Organization of Economic Cooperation and Development, or in short, OECD. Filippo has about 15 years of experience in government and international organization. At the OECD, Filippo has been co-leading the work at the organization and has been developing on the application of behavioral insights to public policy and coordinated and co-authored behavioral insight and public policy lessons from around the world. It is a global mapping of application of BI to public policy around the world. So Filippo has also co-led the development of the OECD work on the organizational performance and independence of regulatory agencies. He also works extensively on good regulatory practice and public sector reform in Europe and Asia. So prior joining OECD, Filippo worked for a number of years in the World Bank, advising governments in Central Asia, Europe, and Latin America, and in the French National Assembly, where he was also a member of team advising the President of the National Assembly. Filippo holds a master in public policy from Harvard Kennedy School. So without further ado, I would like to call upon Mr. Filippo Cavazzini to share his views on the changing behavior through nudge. You have about 15 minutes, Filippo. The screen is yours.
Thank you very much, Dr. Aida. Thank you very much to the government of Malaysia for the kind invitation and for organizing this important conference. I wish I could be with you in Malaysia, but clearly now these online platforms give an opportunity to connect even more easily, and I hope that we'll have other opportunities to meet also in person in Malaysia. Thank you also for the kind introduction. Indeed, I've been working on the application of behavioral economics, behavioral insights to public policy, and now I'm actually working in the economics department of the OECD, where we actually look also at the application of behavioral economics, nudging, together with other more traditional, you would call, instruments to the design and implementation of economic policies and reforms. What I will do in the next 10 minutes, 10, 15 minutes or so is really give you a quick introduction and almost setting the stage on, nudging, what it is, why we talk about nudging, why it is important to talk about nudging when thinking about public policy design, but also implementation, and almost setting the stage for the two other speakers that will follow, who will provide also insights on some of the practices and some of the specific applications of behavioral insights and nudging. So let me share very quickly my slides. Hopefully everything will work. I hope you can see my slides. Yeah, it seems that it's working. Um, I will start with a quick definition of nudging. I'm sure you have heard about Richard Thaler and Cass Sunstein. Richard Thaler, in fact, in 2018 won the Nobel Prize for economics, the prize of the Bank of Sweden, given every year for economics. And in their book, which had the title Nudge, the definition of a nudge is any aspect of the choice architecture that alters people's behavior in a predictable way without forbidding any options. Highlighted these two parts: choice architecture without forbidding any options. What is the thinking behind that? Well, the thinking is that, in a sense, our decisions, the decision of individual, which in a traditional economics are defined as perfectly rational, so perfectly capable of processing all the information, in fact, is not as rational as we think. And there are different elements in the environment where we take decisions that can affect our rationality. The approach of Richard Thaler and Cass Sunstein in that book, that for the first time probably made really a strong case for the application of research that had been going on since the 1960s, Kahneman and Tversky. Kahneman also obtained a Nobel Prize in the 90s, translating them to public policy. And the approach is that we take the policy environment as given, and we tweak the choice architecture, the environment where the individual take decision to ensure that it's the best decision. At the OECD, we have, in a sense, also taken a broader perspective on that approach, starting of thinking and going back to the research done also in the 70s, 60s, 70s, and 90s in terms of really behavioral economics. So the application really of an inductive scientific method and behavioral insights to the study of economic behavior. And more broadly, not only economic behavior, hence the work on behavioral insights that Dr. Haida kindly quoted, that work on behavioral insights and public policies on lessons from around the world, where we really took a very broad perspective and see how really behavioral insights and nudging can be applied to different area of policy, not only, of course, economics. But in all those areas where there has to be a decision, almost an active decision from the users, from the consumers, from the citizens. And why this? Because in traditional economics, we think that we are rational. So we have an intention, and we move from that intention to an action. Be environmentally responsible, an action an individual can take. For example, in an office, I'm now in the office of the OECD in Paris, is, for example, print less. But also save for retirement, for example. Well, we know, and there is also traditional standard economics, that you save when, for example, you are working, you are young, when, in a sense, things are going well, so that when things are going less well, and when you are also aging, you have enough savings. So the rational action to take is to enroll in a pension scheme. Or, for example, losing weight or doing exercise to in good health. Again, exercise weekly, that would be the action. Or, for example, enroll in training. Again, thinking back at office life, how important it is to stay abreast of keeping your skills up to date, and so send the registration on time to participate in that training. However, we also know that for all that research I was quoting at the beginning, that sometimes the link between the intention and the action goes somehow wrong. And it goes wrong because there are some biases that as individual we have in the way in which we behave. It's present bias. We value more the present than what will happen in the future. Hence, for example, the problem with saving for retirement when you can save. Or forgetfulness. I mean, we commit to something, but that simply our attention is not there, and we we forget. And linked to that, we fail also to plan, to basically put in place techniques to avoid that forgetfulness, or simply the social context. The social context is not inducive to take certain decisions, or simply that decision is made too difficult, and that difficulties are almost magnified by our brain, and we don't take decisions. All these biases, if you like, to use a term of art, can be thought through the policy cycle. So until now, I was referring to the individual. In fact, some of these biases can be even magnified when individuals work together in organizations. And what we have tried to do at the OECD, and especially now at the economics department where I'm working, where we really look at the core of some of the economic policy reforms that OECD member countries are being conducting, but also countries with which the OECD is working, like Malaysia's, have to take into consideration. And thinking at the policy and the policy development as a policy cycle, from the initial scoping to the design, to making sure that the policy is accepted, to the delivery of the policy, to the monitoring and the evaluation. We will have two excellent speakers who will give us actually very first-hand experience on practices. I just wanted to give you two quick examples on work we have done recently at the OECD in terms of using nudging, but more broadly, I would say, using behavioral insights to improve the effectiveness of policy design and delivery. So I'm looking just at these two aspects as examples. Very quickly, starting with the work we have been conducting in Latvia, which is one of the Baltic states in Europe, is a member of the OECD, and Latvia used to be a member when the Soviet Union existed, was a member of the Soviet Union. And when independence came and Latvia became independent, whereas under the Soviet Union, for example, housing was public, everybody would get somehow a flat. That housing stock was privatized, and so households in Latvia have inherited an housing stock that was mostly built between 1993. 80% of the houses, dwellings in Latvia were built before 1993. Most of them are multi-apartment buildings, about 60%. The average is 40%, for example, for the OECD, and where there is a big problem of quality. In fact, if you look at the graph on the left-hand side, Latvia is one of the countries among the OECD members, in fact, is the third, which has one of the highest share of poor households without a exclusive use of an indoor flushing toilet. These were data taken between 2010 and 2017, but in fact the rate hasn't changed that much also recently. And so there is a big need both to improve the quality, but now with the challenge, for example, of energy and the energy crisis, also of improving the energy and the energy efficiency. And of course, this is an area where you need action that is not necessarily behavioral. You need resources to intervene. You need a regulatory environment that, for example, allows the group of owners in a multi-apartment building to take effective decision to then do renovation and insulation of the building. But it also needs convincing the people to take that action. And therefore, it becomes really important to, for example, design ways of providing access of perspective of owners of apartment to do improvements, to really understand what is the value of that action, but also test, and this is a key aspect of, I would say, the use of behavioral economics. Test different delivery mechanisms that can be put in place to intervene and improve the energy efficiency, but also the quality of the housing stock. This is something that is still ongoing. We have been providing examples to Latvia. Latvia is still testing some opportunities, but this is definitely something that is important to keep in mind. So an important issue that can be in a sense, somehow also tackle through behavioral economics. Let me go to another example of another work that we have been doing. This time in Chile, another OECD member. On the left-hand side in the graph, you can see that Chile is one of the highest, actually the highest, out-of-pocket spending for health. This is the share of final household consumption. Means that in Chile, households, people spend a lot of money on pharmaceuticals. One way of reducing that out-of-pocket expenditure is to switch from brand pharmaceuticals to generics. On the right-hand side, you can see the poster, the billboard that the government had also designed to, in a sense, facilitate the use of generics, because what we saw was that generics was carrying a sort of a stigma, lack of confidence that this is really the same product as the brand, and because it's cheap, is probably not as good. And so this thing that you think is irrational, because in a sense, in order to be approved, has to have the same medical value, a generic was not being used. And for this, we put together a series of practices that could be put in place to address this challenge, looking both at two sides. On the one side, the practitioners, so the general practitioner, the doctor who would prescribe the pharmaceutical, the generic. Biases can also be on that side, and on the side of the consumer, the users, the person who have to use the generic. There are techniques. One way, of course, is making generics default. So in a sense, they are contrary to the pure use of a nudge, also restricting some of the options, but also changing, in a sense, the choice architecture, providing an easy to understand for practitioners summary list of drugs that can be easily prescribed as generics, but also providing feedback, for example, on peer doctors who are prescribing generics, and can be used as a good example that can provide also some sort of peer pressure. On the sides of the user, the consumers, thinking about how to increase trust in generics in terms of framing that communication. I mean, you can see that billboard there was the stress on the quality, the confidence, and the convenience. That is, for example, was something that was in part tested, but also, for example, using some opinion leaders to transmit the idea that generics are equivalent and therefore good, but also a way of reducing spending, and that again, going back to that social context, the peer pressure aspect, that should not be underestimated. And so, just to quick recap, and then I think we will have the presentation, and then we'll have other opportunities also to exchange. The idea there is that yes, behavioral insights, nudging, which is a way of changing the choice architecture, but not only using experimentation, testing to then address these behavioral barriers, can be powerful tools. Of course, they have to come also with non-behavioral policies. Chile, example of Chile, had a policy, so a conscious policy of introducing generics. And that is, if you like, is an important structural change that has to accompany that behavioral change. Same thing for housing, the example I showed you, very important to have also policy funding decisions that support, of course, that action, because these, of course, are not a solution. These nudges and behavioral intervention are not solution to all problems, but need to be backed by also important structural changes. Let me stop there, and looking forward to the discussion and the other interventions.
Thank you very much, Mr. Filippo. Ladies and gentlemen, in stream 3, you may want to ask questions to Mr. Filippo. Kindly ask the questions. Meanwhile, I'm quite attracted to the example from Chile, in which they spend a lot of money on pharmaceutical, and the nudge project is about to, I think, make them accepted that generic medicine is actually about the same quality quality. But my question, Mr. Filippo, here, I mean, if I'm from the pharmaceutical industry, my BI that I'll do is actually to attract or to give the ideas that the original brands is the best, right? While from the government try their very best to say that generic medicine is equally good. So how do you manage this for the government? You know, shall we put a stop to that kind of advertisement from the pharmaceutical to promote their products, which is better than the others? What do you think about this?
No, thanks, Dr. Ida. This is a very good question, and I think we go back to that point of also the regulatory competition environment that is equally important. So nudges are not enough. I mean, one point is really there has to be, and there will be rules about advertising and competition. And this is the environment where you have to operate. Within this, I would say fair competition. So both generic brands and big industries are of course allowed to advertise. Another point which I think is also very important is that absolutely here is not a matter of restricting or prohibiting the brand. It's simply giving attention to the other choice, the other possibility. Consider that the brand, so the generic comes after the brand has already, in a sense, recovered all the expenses for the development of the medicine. So we are really in an environment of fair competition. But I would say it becomes really important to maintain that environment of fair competition, and that is not about nudging. This is about really regulating. The other point I would say, and this I think you are hinting also at the important point, be wary of the counter nudging. It's clearly not the example of Chile, but there are examples where, for example, I'm thinking about banking industry and prohibiting overdrafting. At one point, there were, in some countries, there were regulations that were actually imposing very extensive information on the cost of basically going in red with your account. Banks might sometimes be quite eager to give it to you because they can charge quite high interest rates. But of course, the individual have to be aware of that. And so hence some of the regulation that provide that information, but sometimes this nudging in terms of the right information at the right time are counteracted by even better information on the value of overdrafting. And all these aspects have to be kept in mind and monitoring very, very attentively, saying that, you know, a nudge is not enough. It's really part, if you like, of a series of policy instruments that have to be used in interaction. That is, I think, is a key point.
Thank you very much. I like what you said just now. The right timing has to be there, because sometimes when we counter nudge, it has to be at the right time. Okay, thank you very much, Mr. Filippo. We have our next speaker. Ladies and gentlemen, later, if you have time, before we end, we can open to use some of the questions if you have, yeah? Meanwhile, let me introduce our second speaker, which is Dr. Manimaran Krishnan, the Director of Institute of Health Behavioural Research, or in short, IPTK. In Malaysia. So Dr. Manimaran is the director of the IPTK, and previously he was appointed as a Chief Executive Officer for Malaysia Health Promotion Board, or in short, MySihat. Dr. Manimaran joined Ministry of Health as Health Education Officer in 1991, and his first posting was at the Institute of Public Health, followed by posting at Division of Disease Control, Hospital Serdang, and IHPR. He has completed his PhD in health psychology and communication, and then he also has a bachelor degree in law. Apart from his vast experience in the field of health education and health promotion for nearly 30 years, he is also a strong advocate in strengthening the community empowerment and behavioral change initiatives for Malaysian population. So we have Dr. Manimaran with us to share his experience. So without further ado, let me call upon Dr. Mani. Over to you, Doctor.
Thank you very much, Dr. Ida for that kind introduction. Also, MPC for inviting me for this evening on this topic. Okay, my presentation will have some theoretical issues as well as operational issues in the Ministry of Health. Um, Basically, the my discussion will be the fundamental human behavior issues for behavior change. Of course, I will also discuss about the nudges as well. The some examples which we used in the Ministry of Health. Okay. Okay. Let me show this picture. My question is whether it's that easy for us to change a person's behavior. The Malaysian government actually spending almost 300,000 to 1 million to this overhead bridge in the country. Okay, for a human being, he has all the moral obligation to follow so obey the law because of the safety, not causing any inconvenience to the people. What about this animal here? I don't think so. The animal is actually using any cognitive process to cross the bridge. But for being a human being, they need to use their cognitive process in order for them to cross the road by using the overhead bridge. Okay. Why we are showing this? Basically, it is not a simple process to change human behavior. It's a very complex, multi-dimensional, and it's not a linear process. Basically, like what happened to the guy just now crossing the road. He been using this behavior for very long. So it requires a person to disrupt a current habit while simultaneously fostering a new possibly unfamiliar set of actions. Basically, it's not that easy because this guy must be used to cross the road by not using the overhead bridge. So it is that not that easy for us to change immediately because behavior change is hard and takes time. Okay. Basically, we need to have a very good understanding about human psychology because it is very important and crucial. It's very crucial for behavior change, basically, because any behavior change is an action, activity, or process. Basically, it is response to an internal stimulation, basically a cognitive process where it involves the thoughts and feelings, whereas the external stimulation is a physical and social environment which actually predict the behavioral change. Okay, behaviors such as health behaviors are affected by factors relating to the individual, basically the predisposing factors. They must have enough knowledge, beliefs, as well as attitude, values as well as attitudes. It's not like that simple for a person to make a choice or change the behavior which been practicing such a long time. See, so there are also reinforcing factors like a family, friends, as well as life events, like a family support, friend support, as well as the media support for the person to change. Okay, whereas the enabling factors, for example, for a person to do a screening, there must be facilities for the person to do the screening as well. For example, to throw a rubbish, there must be enough rubbish bin for a person to throw the rubbish. So in this aspect, basically the predisposing factors, reinforcing factors, as well as enablers are actually works together, works hand in hand, interact for a better behavioral change. Okay. Okay, we look into this health behavior. It's a very complex behavior because we are dealing with sick people, people with a lot of anxiety, people with a lot of psychological problem, as well as they don't willing to listen to anybody except the doctors. You see, like we're talking about non-communicable disease, basically it's like diabetes, hypertension, cancer, as well as mental health issues. See, there are genetic factors. These are predisposing factors where people may have some like family history of disease, genetic issues as well. It's already in their blood. Whereas environmental factors like air pollution, other issues, which actually related to environment issues, age, gender, race, ethnicity, education, and income. But actually, the most crucial issues here for non-communicable disease is actually tobacco use, alcohol use, physical activity, person's weight, food choice, dental health care, as well as mental health. You see, these are the important factors which is actually could be prevented. Although we are talking about other genetic factors, environmental factors, as well as socio-demographic factors, but this non behavioral issues plays very important factor for a person to contract with diseases, especially non-communicable disease, which I mentioned just now. As well as when we're talking about communicable disease, the human factors plays very important role in contracting disease in a person. Okay, let us see this importance of behavioral component in population health. When you see there are health outcomes, basically some mortality and morbidity, whereas the health factors, basically you look into this health behaviors actually makes up of 30%, which is tobacco use, diet, alcohol use, unsafe sex. Clinical care is only 20%, whereas socio-economic factors is about 40%, physical environment is 10%. So when we're talking here, basically it's the clinical issue is not that much. Basically it involves health behaviors, socio-economic factors, as well as physical environment, which actually makes up a lot of mortality as well as morbidity. Okay, then we know we need to address this before we bring about change to a person. Okay, when you see the problem in our country, basically NCD, non-communicable disease, basically the prevalence of lifestyle diseases among adult Malaysians are quite worrying because of their lifestyle. Basically, they do not do exercise. Although they have a lot of information about, the risk factors, but in terms of behavioral change is very, very little. Even our research shows that, the literacy is quite good, the knowledge about disease are quite good, but when it comes to predicting the behavior, it's not that great. Malaysians are Southeast Asia's fattest. We have 52.3% of Malaysians are fat and obese. So all this actually related to behavior. Okay, what are the common errors actually when we are applying this behavior change in NCD prevention? Basically, we think understanding human behavior is a common sense. Basically, it's not a common sense. It is actually basically it's a science where it's actually looking into human psychology, sociology, as well as anthropological evidence. So but many times we think that we just tell a person the person can change, but it's not that. It must be a scientific way of understanding the human being before we come up with some policies for a change. And basically we also thinking that sending a message, communicating a message can change human behavior. Basically it's not that. Message doesn't bring about change. Third, knowledge and information drive behavior. Also, this is a fundamental belief. It's not applicable because knowledge gives awareness, don't bring about change. For a behavior change, actually it goes beyond. There are a lot of other factors actually interact to bring about change. Okay. Assuming people act rationally after having knowledge, also not right. We also assume that by giving them knowledge, by giving them telling them okay what to do, what supposed not to do, people will act rationally. They also change their behavior, which is also wrong. And also it is possible to predict behavior change accurately. Definitely, with all the understanding about this human behavior, uh, uh, scientifically, coming out with some steps, some come out strategies and all that, still things can go wrong. People may not change as what we want. Okay, so in health behavior, the importance of behavioral science is very crucial, where we need to understand the thoughts, decision, as well as interaction. Basically, even to take a medication and put inside your mouth, you need some motivation. You need some kind of a awareness. You have knowledge. You must know what are the benefits, what are the barriers, and all that. So before they want to do something, they need to have all this in order for them to take action. Okay, so providing in-depth understanding on human-related behaviors will aid good planning, precise and targeted intervention, and also understanding, give a broader understanding on disease causation that goes beyond biomedical approaches, because most of the time we are used biomedical approaches where the basically like doing a diagnosis, prognosis, medication. Then people like to wait for the doctors, then they go back. You see, so this is not just understanding about the biomedical aspect. We also need to understand their behavioral factors behind the biomedical issues as well. So by coming out this kind of strategies, actually basically will give a low cost solution, because the behavioral change strategies are very cost effective and actually last long lasting as well. Okay, in Malaysia, this behavioral science approach has been used in national-based health promotion initiative, as well as in intervention to nudge people to change their behavior. It's not something new. Using behavioral science in Ministry of Health is actually we started in 1970 by introducing a lot of behavioral science approaches and intervention. But the problem is, as I mentioned earlier, understanding human behavior in terms of health is very crucial, very tough, very hard. It is a multi-dimensional issue. It's multifactorial. So we only can bring about some changes in terms of knowledge, literacy, rather than predict a lot of behaviors in the behavioral change. Yeah? So okay, Ministry of Health actually they have worked with various agencies as well, professionals actually to implement this kind of health promotion activities. Okay, let us see. We started our behavioral science in practice in 1991, where we started our healthy lifestyle campaign in 1991. So the approach from 1991 to 1996 was actually basically about awareness, educating people, creating a more to elevate their knowledge about diseases and also the risk factors. The strategy is basically uh, the strategy basically is disease based. It's not behavioral based. Whereas in 1997 to 2002, also we continue with awareness as well as education, but it's behavioral based. Whereas 2003 to 2010, basically until now, a lot of strategies being used: behavior change, communication, behavior modification, and also community empowerment. So when you see these strategies are basically like a behavior change according to the setting, like schools, factories, community, like behavior intervention and empowerment, like role modeling, supportive environment, as well as capacity building. Examples of initiative for 1991 to 96 are Healthy Lifestyle Campaign. 97 to 2002, the Healthy Lifestyle Campaign still been continued. And 2003 to 2010, basically it's a lifestyle campaign, but we changed the strategies as well as the team according to the years and also the by diseases. So later for 2011 and 2020, a lot of community-based projects like a Young Doctors Program, Communication for Behavior Impact, Wellness Hub, as well as COSPAN, community-based NCD program. So now for 2020 to 2030, there's a new approach called Help Malaysia National Agenda, which is actually talking about social capital. Okay, these are the programs actually use behavioral science approach in our country. Okay, we talk about certain nudges. Okay, I think the earlier speaker already explained about this. What is nudge? It should be soft, prompt humans, and towards choice that good for them, and also judged by them. It's not there's no force. It's actually heuristic, because when you talk about the traditional way of doing campaign, it actually goes through the phase in phases like awareness, knowledge, change the attitude, intention, then behavior. But in this case, because this goes through the hierarchy of communication, but actually here we are talking about cut short. Straight away they practice something. Without going through the process of thinking. Okay, for very simple example is that when you go to the mama shop, you may don't have any intention to eat Maggie or order Maggie that day, but because of the priming, but you don't go through the awareness, knowledge, and motivation or intention, or finally you order for a Maggie. Basically, you go there, you look at that way they uh, place the Maggie packets and all that. Then actually it will urge you to order for this, to motivate you for order the Maggie. But actually in your intention you may don't have any uh, thinking about ordering Maggie. You see that day. Okay. Right. Okay. So let me give you some of the examples in our country use nudges. Okay. It's going backwards. All right. Okay. Um, okay. If you look into this COVID-19, basically during the COVID-19, the My Sujatra application been used wisely, very widely as well. I'm sure without the My Sujatra scheduling system, I don't think so we can achieve this 84.3% of Malaysians' total population who have completed two COVID-19 vaccine doses as of March 2023, and also 50% has completed the first booster shot. Basically, because the default nudge basically strategy provides the basis when people automatically enroll into something that generally tend to accept it. They have no choice. So the system actually give them the scheduling. So basically, the digitalization process happen here, and we are by through this we able to nudge about 84% of people who the Malaysians total population have completed their two COVID-19 vaccine doses. Okay. Incentives. Recently, we also launched this National Health Screening Initiatives. NHSI was actually it launched last year, July 2022. Initially, it was very slow, but when we start with the free screening incentive, by also involve the PECA B40. So by this year, January, there are almost 834,000 population already gone for the free screening. So this also nudged that because it's free. It norms.
Dr. Mani, if we can
Yeah.
have 1 or 2 minutes so that we can take questions.
Wow. So a lot of things I have to. Okay. Norms basically is like people have to follow the norms during the COVID-19. Wearing mask is not something very common, but because of everybody wearing, so people start wearing. Exercise behavior as well. No smoking was gazetted in in eateries and all that. People do not smoke there because of others not smoking. Priming, like we also started this Jom Night Hunger initiative where you go to the government offices and all that. You can see the calorie calorie count being, if you take staircase, how much of calorie you can burn and all that. Also do not take the, if you place some kind of posters on the lift and all that. And they also introduced this healthy plate. There are national and health and mobility survey in 2019 shows that 1 in 5 Malaysians are aware about this healthy plate. There are 64% been practicing about this concept. This healthy plate is basically quarter plate rice, quarter protein, and half plate of vegetables and fruits. Okay. then effect basically it's a message in the medias and all that, where also nudge people to take action, especially during the COVID time. Okay, we are looking forward more people will exercise. Basically, through our national and health mobility survey shows that more people are doing exercise. Initially, 2006, it's about 56%, but the recent one shows that 70, about almost 75% people do exercise. Okay, the most important thing is here. We also become Malaysia has played a significant role leading in the development of the resolution on behavioral science during the 152nd executive board meeting recently of WHO. Basically, the resolution has been accepted and adopted by all member states of the country. This is actually behavioral science for better health, which is actually nudging the policymakers. Okay, what are the problems we are facing now? The current healthcare service heavily depend on biomedical model. Like I said, you go to the hospital, basically it's been diagnosed based on the pain, disease, and defect. People, people are overwhelmed the biomedical model or medical model where they go to the hospital. They like to wait for the doctors, and they go enter the room. The doctors tell them, okay, well, you okay, your HbA1c is fine, go back, So they are very happy, but they don't involve very much in changing their behavior. So, as I say, the psychological or social history of the patients are not included in the diagnosis of the illness. So, slow progression in creating health policies that supports the behavior change. As I said, understanding the human behavior is important. We come out with the strategies as well, but the policies also must support the behavior change. But just using nudge, I don't think so. We can change people's behavior, 100%. Okay. Uh, beside other factors, the individual and community health behaviors are strongly influenced by the social determinants like environment. Like we have 24 hours restaurant. We are saying go for healthy diet, but restaurants are open for 24 hours. So this kind of issues must be solved in order for us to change better. People change their behavior better. Okay. The health staff also must realign their thinking. It is not very much on medical model as well. They also must start using the biopsychosocial model. Okay. With that, I think I like to recap that the understanding of human behavior is important in any behavioral change, especially in a healthcare setting. It's not that easy, as I said. It's very uh, multifactorial, multidimensional. So we really need to understand because we are dealing with sick people and also human beings. Thank you very much.
Thank you very much, Dr. Manimaran, for the sharing. We, as a Malaysian citizen, are so proud of the performance of Minister of Health to handle COVID-19. So I will take, there are many questions, but I think due to the time, and we have another speaker, I'll take a few questions. Yeah. Okay, Dr. Manimaran, how long do you need to give time for nudge to take effect? Uh, if it is time for us to change the nudge. So based on your experience, what is the time like from scoping to delivery, and how long it can take effect?
It's a very subjective, Dr. Ida. Basically, like during the COVID time, it's very fast. Initially we did the survey about the vaccine uptake. Shows that it's about first we done the survey among the population. It shows about almost 87% of Malaysians are willing to take the vaccine. So with that information, we straight away roll out the vaccine for the people. And actually, people are very worried about the death during the time because the newspapers, the media brought a lot of issues about death, miseries during the COVID time. So actually, it's not very fast. But certain behavior like smoking will take more time. Like the immediate effect, like a vaccine for COVID, because the entire world was affected with this COVID. So it's much more easier. Whereas certain behavior like smoking, eating is also same problem because we've been this is a cultural embedded issue. We've been eating for 20, 30 years. Suddenly you ask a person to use healthy plate, suku suku sparu. I don't think so. People will change that easy because and most of the time the plate full of rice. But suddenly you ask them, you have quarter rice, quarter protein, and plate of half of the plate with vegetables and fruits. I don't think so. It's going to happen immediately. People may show the intention, but it will take some time. And also the policy, as I said, must also must trigger. You go to the shopping eateries and all that. They also must practice that, but they have no plate. Basically, they like a banana leaf. There's no. It's a big banana leaf. You can put so much of rice there. So what we're talking about suku suku sparo. So all this must be in place. Then it will bring about the change immediately. Okay. Thank you.
Okay, thank you. One last question. One of the participants asked, he or she, just curious if social media is able to influence behavior change in a positive way. What do you think about this?
I we welcome that definitely. But as I mentioned earlier in my presentation, there are five important errors which mainly we make during this, for the behavioral change, especially changing from something to better thing. We think that uh, uh, media or knowledge can predict people's behavior, which is actually not that simple as we think. Where, as I say, we've been doing this healthy lifestyle campaign for almost 30 years, since from 91, where I joined the service. And I joined the service, they started the campaign, Love Your Heart. But we only able to elevate the knowledge. The knowledge about risk factors are very high. When we do a survey with asking about people whether dengue is dangerous, maybe you ask 100 people, maybe 101 say yes. That that many knows about it. The risk factors. But when it comes to the predicting the behavior is very it's always questionable. I mean, the model also, the behavioral change model also says that. I'm sure you also well understand that. So people may whether it is high involvement or low involvement. If health is high involvement, basically people will immediately they change. But talking about the social media, if it can change. Well, good, but it's not that easy as I said. It takes so much of time. As I said, the policy must be there. The human being itself should, have the intention to change. Thank you.
Okay, thank you very much, Dr. Manimaran. On behalf of the participants here, we would like to thank you again for the sharing. Okay, we have our last speaker. Ladies and gentlemen, after we have our last speaker, please be ready with your camera. We would like to take photos, yeah? So please bear with us. Let me introduce our last speaker for today, which is Mr. Anwar bin Ramli. He's an accountant from Sungai Petani Municipal Council. For the non-Malaysians, for your information, Sungai Petani is located at the north of Peninsular Malaysia, which is a border to Thailand. Yeah. So Mr. Anwar is the head of Revenue Management Division of Sungai Petani Municipal Council from 2017 until 2023 until now. He was with College Polytech Mara as Assistant of Finance Director, and he was also with Oriental Summit Industries in Riam Berhad, the RB Highcom subsidiary company, as accountant executive. Mr. Anwar is responsible in conducting a case study in Sungai Petani Municipal Council, or in short MPSP, on collecting taxes. So today our talks will be on money matters, yeah, where it can be a laborious works for the authorities, as in the same instances they are at the mercy of the taxpayers who should later be choose not to pay or to pay their dues. This is the case of Sungai Petani Municipal Council, which has been experiencing high assessment tax areas and the highest relative to the number of premises to the other municipal councils in Kedah. So MPSP recorded tax areas worth 26 million in 2018 alone. The Malaysia Productivity Corporation stepped in to help them deal with this issue, in which to identify why this is happening and what can be done to overcome it through the adoption of behavioral insights. Um, Among the topics were nudging taxpayers to pay assessment tax without delay and encourage youth to be innovative and accelerating digital adoption among the entrepreneurs. So without further ado, I would like to call upon our speaker for today, which is Mr. Anwar. Over to you, Mr. Anwar.
Thank you, Dr. Ida. Assalamualaikum. Very good evening. I'm Anwar, accountant of Sungai Petani Municipal Council, and for today, I would like to share some best practices that we have adapted in Sungai Petani, which collecting the assessment tax areas with the use of nudge. So, ladies and gentlemen, with the use of nudge, can it help us in collect tax? Actually, in Sungai Petani, there are about 170 millions, 170,000 tax has been implemented that actually, I'm sorry. Okay, actually in Sungai Petani, there are 170,000 premises that are subjected to tax, and Sungai Petani Municipal Council is a council that recorded the highest areas in assessment tax. So many steps has been taken to reduce the areas, like we investigate the premises that have high areas, and we also confiscated the property. And in 2022, with collaboration with MPC, we are doing implementing of nudges. So let me share the slide first. Okay, what actually have we done? We made nudge project in 2022. We modify and improve the features of our notice. Okay, first, let's see the notice before and after. The notice name is Notice E. It is the notice based on our local authority acts. First, what we have done is we change the structure of our notice. As you can see from our notice, we organize the notice, become more presentable and become more organized, so people can see the notice in a good way. Then we enlarge the font of words. We pay immediately is the words that we use to attract attention. And next, we color the words to create awareness. Actually, the word cease and auction, we color the red color because we want to create awareness to the taxpayer for them to pay their assessment tax. Next, we also use persuasive sentences in our notice. Let's pay online, fast, easy, and safe, to create attention so that people can pay their assessment tax easily. And lastly, we also put QR code to facilitate our payment. We believe once we put our QR code at the notice, it can help and encourage people to pay their assessment tax. So these are the features of our Notice E that we have implemented. So what is the next step? The next step is with cooperation of our IT departments, we speak and select the samples of 4,003 accounts or premises that have area to 3.4 million. We use the element of nudge in our notice E, SMS, and also our red notice. So all this intervention that we have done really have the element of nudges. And after 4 months of implementation, we actually the account from 4,003 reduced to 3,380 premises that have arrears, which 620 accounts have made payment amounting 533,000. It is more than 1 million. It is more than half a million, sorry. So how can we assure that nudges is the factor that contribute to this? Actually, we have analyzed our data from 2017 to 2022. We exclude 2020 and 21 because of COVID. So from our analysis, so we can see that the implementation of nudge in 2022 increased the likely for people to pay their assessment tax by 49%. The number of premises that pay their assessment tax arrears increased to 206 compared to 2019, only 138. So the second intervention, SMS. After we have done SMS, we include the element of nudge in our SMS. The increasing of people paying their assessment tax increased to 189 premises compared to 2019, only 36 premises that paid. It increased by 425%. And lastly, our red notice that we have implemented in June 2022, the implementation of NAS increased by 435%, which 225 premises that pay their assessment tax compared to 2019. So, in conclusion, what can I say? Actually, nudging did increase the effectiveness of our policy. We enable optimal allocation of resources to achieve better outcome, and I'm glad to inform that nudge really can change the behavior of people's. That's all from me. I'm sorry.
Hey, thank you very much. Thank you very much, Mr. Anwar. To me, it's very impressive. You can reduce the areas by 15%. It's a lot. Yeah. Okay. If there is any question, yeah, please let the secretariat know. Okay, I have one question to start the ball rolling. Mr. Anwar, you mentioned you check about 4 months, yeah, to see some effects. So maybe I know what is the future projects or perhaps undergoing projects by Singapore Municipal Council as far as nudging is concerned, change behavior through nudge. Is there anything in the pipeline?
Okay, in future, actually, before this, we have implement nudges in assessment tax. So the next project is nudges in compound or license or also the rental. So we also can use nudges to create awareness and convince people to pay not only in assessment tax but also the other revenue that our agency collects.
Okay, thank you. I know that you are accountant, but there is a question by the participant asking that since you touch about the local council matters, how can you nudge theory be used to address local social issues such as reducing crime? What do you think about it? Can we
Sorry,
use
reducing.
nudge for that? A crime in the
Oh,
locality.
crime. Okay.
Uh-huh.
Definitely, NASH can NASH can reduce the crime. As we can see in social media, there is we can say the drama or short drama that uh, tell about the consequences. So, with element of nudges, and we as municipal council can use our social media. Maybe can use the Facebook to make video to create awareness. So, I think we can do this to to reduce the crime.
Yeah, okay, it can be done as well, yeah, as far as crime is concerned. Thank you very much for your sharing, Mr. Anwar. And on behalf of Malaysia Productivity Corporation, we would like to thank all the three speakers, and to the participants, thank you for joining us half day today for the National Conference on Behavioural Insights 2023. So if I think if we can have photos, yeah, we can switch on the camera. Okay, let me take the photos of the speakers. I'm not sure whether I can get photos of the participants as well. Let me take the photos of the panelists first. Okay, 1, 2, 3. Thank you. Okay, ladies and gentlemen, we have come to the end of the session. On behalf of the organizer, Malaysia Productivity Corporation, we would like to thank everyone for joining us today. So I would like to close the session, but of course, before it ends, we have a video being played afterwards. Yeah. So thank you very much again, ladies and gentlemen. Till we meet again in the conference next year. Bye.
Thank you very much. Ladies and gentlemen, we have now come to the end of our conference. I would like to express our appreciation to all the speakers who have shared their insights on changing behavior through nudge. I would like to thank Mr. Filippo Cavassini, Dr. Manimaran Analaki Krishnan Kaundan, and also Mr. Muhammad Anwar Ramli for all your presentations on how nudges can be used to promote positive behaviors in the society at large. Your insights into the economics of behavior change have been truly informative, and we appreciate your experience in this field. So, in conclusion, I would like to express our sincere appreciation to all the speakers for their valuable contributions. Your insights have been truly informative and thought provoking, and we hope that this discussion, as well as the presentations made, have provided everyone with inspirations and insights into how we can use nudges to promote positive behavior change. Thank you all for joining us today, and we look forward to seeing you soon next time. And to all my Muslim brothers, I wish you all Ramadan Kareem. Assalamualaikum, and have a productive day ahead. Said Munawar signing off.